Module 14, Nutrition through the life cycle, pregnancy and the first year of life. Nutrition before and during pregnancy. A woman's nutrition even before conception can have a dramatic effect on her pregnancy. A healthy preconception diet reduces the risk of pregnancy problems, especially during the first few weeks of life. Some of the necessary nutrients prior to pregnancy include folate, affects brain and spinal cord development, vitamin B12, regenerates the active form of folate, vitamin C, needed for the synthesis of collagen, vitamin D, develops stronger bones, teeth, and vitamin A, helps with postpartum tissue repair. Pregnant women require additional calories to support the growth and development of the fetus, as well as to meet their own increased energy needs. Most nutritional needs can be met through a healthful, balanced diet. A woman's protein needs increase during pregnancy. Adequate protein intake is crucial for fetal tissue growth, placenta formation, and the synthesis of maternal tissues. Carbohydrates serve as the primary energy source and help prevent ketosis, a potentially harmful metabolic state for both the mother and fetus. Carbohydrates should come from whole grains, brown rice, legumes, fruits, and vegetables to increase vitamin and fiber intake. The percentage of calories from fat does not change during pregnancy, however. Essential fatty acids, such as omega-3 fatty acids, play a critical role in the development of the fetal brain and nervous system. It is cautioned that pregnant/breastfeeding women should avoid overconsumption of certain types of fish, such as swordfish, tuna, mackerel, due to their higher levels of mercury. Mercury can damage the developing fetus's nervous system. In addition to the aforementioned macronutrients, there are important micronutrients that play an important role during a pregnancy. Sufficient iodine intake is necessary for the synthesis of thyroid hormones, which are critical for fetal brain development. Calcium and vitamin D are vital for fetal bone development and maintaining maternal bone health. Adequate intake of folic acid during the early stages of pregnancy helps prevent neural tube defects in the developing fetus. Iron requirements increase during pregnancy to support the expansion of maternal blood volume and prevent maternal and fetal anemia. Iron requirements cannot be met only through a well-balanced diet. Therefore, supplements are often needed. Iron stores of the mother are depleted to support the needs of the fetus. Due to this, iron deficiency anemia is common during pregnancy. While it is important to focus on which items are important to consume during pregnancy, it is equally important to be aware of which items to avoid while pregnant. Pregnant women should reduce their caffeine intake as caffeine can reach the placenta and potentially affect the baby. Foods to avoid while pregnant include unpasteurized milk/juice/cheese, raw or partially cooked eggs/meat/fish/poultry, raw sprouts, and multiple varieties of large fish. Alcohol, smoking, and drugs should also be avoided during a pregnancy. Alcohol is a known teratogen that crosses the placenta and is associated with various birth defects, delivery complications, sudden infant death syndrome, and increased risk of miscarriage. Maternal smoking exposes the fetus to toxins, leading to an increased risk of miscarriage, stillbirth, placental abnormalities, preterm delivery, and low birth weight. Most drugs pass through the placenta into fetal blood, leading to newborns suffering from postpartum withdrawal symptoms. Due to the dramatic hormonal, physiological, and metabolic changes that occur during pregnancy, there are also multiple nutritional concerns for pregnant women. A common concern is morning sickness, the nausea associated with the first few months of pregnancy. However, morning sickness can last for the entire pregnancy is not limited to the mornings. Another concern is gestational diabetes, the insufficient insulin production or insulin resistance that increases blood glucose levels during pregnancy. This condition resolves after birth occurs, though. A very serious concern during pregnancy is preeclampsia, an increase in the maternal blood pressure. Deficiencies in vitamin C, vitamin E, and magnesium increase the risk for preeclampsia. If left untreated, preeclampsia can be fatal. The only cure for this condition is childbirth. Nutrition after pregnancy. Adequate nutrition is essential during the postpartum period to promote healing, regain strength, and support lactation. Consuming a balanced diet with a focus on nutrient-dense foods is crucial. Breast milk is the optimal source of nutrition for infants, providing all the necessary nutrients and immune factors. Lactating women should maintain a well-rounded diet, including increased calorie intake to support milk production. Key nutrients, such as vitamin B12, omega-3 fatty acids, and iodine, should be emphasized during breastfeeding. Docosahexaenoic acid, DHA, an omega-3 fatty acid found in breast milk, is essential to the development of the infant's nervous system and retinas. Also, the protein in breast milk is easier for the infant to digest compared to cow's milk. This reduces the risk of gastric distress for the infant. Additionally, the antibodies and immune factors found in breast milk help to protect the infant from infections. Further, breastfeeding is convenient, cost-effective, and can assist the mother in weight loss. While breast milk or formula meets an infant's fluid needs, there is always the potential risk of dehydration. Compared to adults, infants are at a higher risk for dehydration. This is due to many factors including the infant's immature kidneys and the higher rate of fluid lost during evaporation. Infants begin to need solid foods at approximately 6 months old. As with pregnancy, it is important to know what food items you should give an infant and the items you should avoid. Foods to never feed an infant include foods that can cause choking, corn syrup and honey, goat's milk and cow's milk. Too much salt and sugar, only give an infant food that is low in sodium or sugar. Too much formula or breast milk. More than one high allergenic food at once, these foods should be given in isolation so that allergic reactions can be identified. Foods you should feed an infant include iron-fortified foods such as iron-fortified rice cereal. An infant's iron stores deplete at 6 months. Only introduce one food at a time in order to watch for signs of allergies.